Assalamu alaikum. Yes, now let's discuss with the fifth question of our continued part of medicinal chemistry. Okay, part 4. See here medicinal chemistry, we are discussing on the 10 marks important questions and answers. Now next question, see here, you go here for the December 2022, classify NSAIDs and suitable example from each class, write the synthesis of ibuprofen. See, in my second class, second part, I have told you, my dear brothers and sisters, NSAID and anti-inflammatory both are same. If they ask anti-inflammatory, you write same NSAID. Or if they ask NSAID, means NSAID is nothing but non-steroidal anti-inflammatory drugs. If they ask anyone from these, means both are same. Both are same, you can write that. So for that reason I am telling, don't come directly for this video, you will not understand. First go part 1, part 2, part 3, then come for part 4. Inshallah, in upcoming part we will complete our 10 marks questions. Now next we will jump for the 5 marks. Now let's come across this one. Which one? See, classify NSAID with suitable example. Each class write the synthesis of the ibuprofen. See, directly I have given here synthesis of ibuprofen. Why? Because see, NSAID and anti-inflammatory is same. I have done that in the part 2. You can go and observe that video, and if you want the notes, check in the description of that video. See, synthesis of ibuprofen. Synthesis is very simple. Isobutyl benzene. See, it is isobutyl benzene. React with the ammonium. CS3COCl, acid chloride. In the process of aluminum trichloride or aluminum chloride, you will get one complex product that will be react with the hydrogen catalyst. There will be formation of one more complex product. That complex product again reacted in the presence of carbon monoxide in the presence of catalyst, formation of the ibuprofen. You know that ibuprofen, it is the painkiller or the NSAID drug which is used to treat the pain, which is used for to treat the inflammation. Yeah. Now let's move towards the next sixth question. Very important one, very important one, because this question asked many times in our examination. What are sympathomimetic agents? Discuss their classification, and SAR give the synthesis of the salbutamol. See, in the year June 2022 this question was asked. In the year 2019 this question was asked. March 2021 this question was asked. But the asking of the pattern is a little different. Minute changes here. See, sympathomimetic agents and the sympathomimetic agent and adrenergic agents both are same. Don't get confused here. See this one. Define and classify adrenergic agents, SAR of adrenergic antagonist agents, and write the synthesis of the phenylpyrine. Adrenergic agonist agents same. Adrenergic agents also same. Sympathomimetic agent also same. Both definitions are same. Here all the classifications are same for these three different words. You have to write the synthesis what they asked. Simple. One they will ask a salbutamol, the next one is phenylpyrine. These are very simple. And one more you understand here, one confusing pattern is there. See here, what are adrenergic blockers are different. Adrenergic blockers are different here. I will tell you later that. You don't worry. But you go for this one first. Which one? Sympathomimetic. These are also known as adrenergic drugs. These are the drugs which mimic the effects of endogenous agonist, okay, of the sympathetic nervous system. Very simple. What is this means? See, these are the external supplied drugs, adrenergic drugs. Here what they will do, they will mimic the effects of the endogenous agonist. Means the work done by this epinephrine and non-epinephrine, these agents will be proceed them, or these agents will be carry, okay, of the sympathetic nervous system. You know that in the autonomic nervous system there are two classification. One is sympathetic, another one is parasympathetic. Sympathetic nervous system, what it will do, it will, now for an example, our heart pumps very fast, like 100 beats per minute, 102 beats per minute, actual 65 to 72 to 80 degree. But here what happens, our heart pumps for 100 degree. Now these pumping of heart fast for 100 degree is carried by this sympathetic nervous system. Now at a certain time our heart should be slows down, like 72 degree beats per minute. That slowing nature was carried by, that is conducted by parasympathetic nervous system. Clear? Proceed. Those who will tell to do the work, that is the sympathetic. Those will reduce the work, that is known as parasympathetic. See, increase in heart rate, force of cardiac contraction and blood pressure. Example, classification of the sympathetic agents: direct acting, indirect acting, mixed acting. These are the three classification. Let's discuss about what is this direct acting. In the name itself, it is indicated it will act directly on the effector side, or see, I will tell you. These agents produce a sympathetic response by interacting directly with the adrenergic receptors. See, adrenergic receptors, generally these are the receptors which present in our body tissues: alpha receptor, beta receptors. Basic, these are the receptors. These receptors, what it will do, they will collect the information, or they will collect the drug and show the action. Very simple. Now see, these are the adrenergic receptor A. Now this is the drug, means which drug? Sympathomimetic drug. Now these adrenergic receptors, what they will do, they will collect these drugs and they will show the action. Very simple. Alpha, beta, two types are there. Depending on the drug, it seems. The action produced are on rapid onset and are short duration. See here on the direct acting drugs, here these are the very short duration action, means very quick here. These drugs affect both alpha and beta receptors. Both means these drugs, which drugs? These direct acting drugs, these will settled, or they will effect on both alpha type and beta type receptors. Example, norepinephrine. See, norepinephrine, this is the structure of the norepinephrine. It is used to decrease the chances of hemorrhage during an operation. In operation, sometimes what happens, there will be chance of the excess bleeding. To stop that excess bleeding, we are giving norepinephrine. It is given by IV for the treatment of hypotension. Okay, to treat the hypotension, means if the patient suffers from the hypotension, then also we are giving this a norepinephrine to increase the blood pressure. Then next is epinephrine. Epinephrine, see, this is the structure of the epinephrine. which same, you just understand here, only CS3 group is absent, where in the norepinephrine, here CS3 group is present. See, very simple. It is used in the emergency treatment of the anaphylaxis and anaphylactic shock in the cardiopulmonary disease. Very important, this epinephrine. See what happens, sometimes due to the severe allergic conditions, this anaphylaxis occurs. Severe allergic conditions means suddenly our heart stops to beat, suddenly our lungs stop breathing, means they will stop the function of the purification of the air. Why? Because of this anaphylaxis. Then we are giving this epinephrine. Doctors are giving epinephrine. Yes, my dear brothers and sisters, now next, the third drug in the direct acting, that is phenylphrine. Very important one, phenylphrine, IUPAC name 2-methylamino 1,3-hydroxyphenyl ethanol. This is the structure of phenylphrine. Very simple, 1,2,3-hydroxy 2-methylamino. Okay, very simple, 2-methylamino 3-hydroxy 1,2,3-hydroxy ethanol. Now synthesizes when metachloroacetylphenol made to react with the methylamine, reduction carries phenylphrine is the end product. Very simple one. Uses, see, this is mainly used as a decongest in the rhinitis and the sinusitis. Means mainly we are using this as a decongestant, means congestion problem. This combination medication is used for temporarily treat cough, common cold or other breathing problems. Means some in the combination of the drugs like paracetamol, phenylphylline, chlorpheniramine, combined drugs, Synarest. You go for Synarest, you look there you will get a phenylphrine, paracetamol. This phenylphrine will be combined with those drugs and increase the action, and also it reduces the cough, cold and allergic reactions, allergic conditions. Next, indirect acting drugs. Indirect means in the name itself indicating they will act indirectly. How they will act indirectly? These drugs produce their effects mainly by releasing noradrenaline from the storage site in the sympathetic nervous to the effector organs. They have a slower onset. Just opposite to this one. See what is this? I will give you one example. These are the direct and these are the indirect. Indirect acting, what they will do? These will directly act on the receptors. Means they will just go and settle on the receptors. But here in indirect acting, what they will do? See, these are the receptors. Okay, these are the receptors. These are the noradrenaline, means storage sites. First, what they will do? Storage sites. First, these drugs, first they go to the storage site. then they will release the storage from the storage site receptors, then these receptors, okay, they come outside. After that, these drugs go and bind to that receptors. Lengthy process. Which one? Indirect one. These drugs don't themselves react with the receptor but causes release of neurotransmitter from storage site which interacts with the receptor. Means these drugs, they don't themselves react with the receptors. No, they won't. But they causes to release the neurotransmitters. What they will do, I have told you. These indirect drugs, they won't react directly like the direct acting drugs. Just they go and act to the receptors. No, they go to the neurotransmitters and they will which one promote these neurotransmitters to go and attack to the sites, alpha and beta sites, not these indirect acting drugs. They will promote, for which they will promote the neurotransmitters. Very simple. Example, say hydroxy amphetamine. Very simple. Hydroxyamphetamine structure. Practice this structure. Used as an eye drop to dilate the pupil. Used as a diagnostic agent for testing Horner's disease, means damage of nerves of the eye. If the nerve damage means we are using this drug. Which drug? Hydroxyamphetamine, to test whether our eyes nerves are right or wrong, means accurate, correct or not. Clear. Now next one is the B. Example for the means indirect acting drugs. Propyl hexyridine. Okay, propyl hexyridine, the structure without benzene ring. Okay, these are without benzene, means ring is there, but sorry, saturated type, not unsaturated, saturated type. It has a vasoconstrictive effects. It is used medically for relief of the congestion due to the colds, allergies and rhinitis. Mixed acting, last classification. These drugs, as the same name indicates, they act both as direct and indirect. Metaraminol, the structure. See, mixed means they will act, sometimes they will act directly, sometimes they will act indirectly. Example, metaraminol. It is used as a precursor agent in various hypotensive states. In various hypotensive agents we are using this. And then the next one more example is ephedrine. Ephedrine also we are using as a mixed drug, acting drugs. Yeah. Next very important concept is a SAR of sympathomimetic agents or adrenergic agents, okay, or adrenergic acting drugs, SAR. See, a substitution on the aromatic ring of beta phenylthylamine. Very simple, very simple. See here, I have told you in my previous video, SAR is nothing but the structural activity relationship. Here we are studying the structural activity. Means main the work here is the substitution groups. Now OH, amine, how they attacked, on which position. Why either they attacked on first position of the benzene ring, second position of the benzene ring. What happens if they attack to the first position? What happened if they attack for the second position? If not, what happens? These all conclusions we already studied in the previous video. Now here see, very easy. The presence of OH group in the benzene ring at third and fourth position. Benzene ring, where this one, third and fourth position, 1, 2, 3 and fourth position, just understand the concept here, gives maximum alpha beta activity. If any of this OH group is absent, the overall potential get decrease. Means what the rule says here, the benzene ring should store OH group at third and fourth position. If not present in the third and fourth position, means what happens? The activity of the potentiate decreases. See here, you compare these two structures, phenylpyrene and adrenaline. In adrenaline, the third and the fourth position in the benzene ring, they are having the OH groups. But in phenylpyrene, only third position acquires the OH group. See, you are observing here. Here now you can come to conclusion, phenylpyrene having the less potent than this adrenaline because of the substitutions, because of the OH groups. During the next second point, drugs having substituents other than OH group have greater selectivity for the adrenergic receptors. See, I have told you alpha and beta, these are the adrenergic receptors. Again, these alpha and beta classified as alpha 1, alpha 2, beta 1, beta 2. That we will study in the next lecture. See, salbutamol is a beta 2 selective. Okay, now this one is the salbutamol. What they have told? They have told drugs having substituents other than OH. OH is having. Along with the OHC, some more substituent groups are there, like the CS2OH, ethanol, or amine groups having substituent other than drugs having greater selectivity. See, CSC, 3SC, CH3. These are also substituents. Now these will what they will do? They will increase the drug action, drug selectivity. Now substitution on the beta carbon. There we gone for the substitution on the aromatic, but here substitution on the beta carbon. What happens on the beta carbon? OH group on the beta carbon decreases the central stimulant action, okay, due to the lower lipid solubility of the drug. Understand the concept. See, OH group on the beta carbon, this one is the alpha and here it is beta. Beta carbon if present, where in this drug beta carbon is present, it will lowers the potent action. Why? Because these are less soluble in the lipid membranes. Okay, ephedrine, it is the less potent than these amphetamines, because amphetamines no OH group. Yes, actually alpha and beta carbons are there, but no OH groups. Yes, amphetamines are better than these ephedrine. Then the next one is substitution on the alpha carbon. Drugs having substituents on the alpha carbon blocks the metabolism caused by MAO. Those drugs having the alpha carbon, means the drugs should be substituents. Like for an example, see, it is the alpha carbon substituents. If the substituents are present in this way, means what they will do? They will block this MAO. Now what is this MAO? Monoamino oxidase. Okay, these monoamino oxidase, it is the enzyme. These monoamino oxidase, mainly the work of this monoamino oxidase is to metabolism, means deamination process. They will, the main action of deamination or metabolism is carried by the liver, that we call first phase metabolism. When the drug enters into human body, I will tell you with one example. See, when the drug enters into human body, it will enter to the liver. Now here in liver what happens? All the metabolism process takes place. Okay, all the metabolism process takes place. MAO, that is a monoamino oxidase. These exams mainly what it will do? It will break down the product. If the product get breakdowns, means the activity also decreases here. Now for an example, 500 mg tablet get breaks down, means it converted to 250 mg tablets. Mg. Now which one is greater? 500 is greater than the 250 mg. Yes, accurate. Sure. Now due to the metabolism by this MAO enzyme, what happens? The activity of the drug decreases. But here this alpha carbon, what they will do? They will block this monoamine oxidase. If the monoamine oxidase get blocked, means they will block, means what happens? No metabolism. No metabolism means good efficacy, good product potency. For an example, amphetamine resist degradation by enzyme. This one, because they are attacked, the substitution attack to the alpha carbon atom. Okay, so there is no chance of degradation, or no chance of not degradation, metabolism, no chance of deamination. Yes, my dear brothers and sisters, these are the very, very important question. The last one is here, synthesis of the salbutamol. See, very simple. Salbutamol synthesizes 4-hydroxy 3-hydroxy-methyl benzaldehyde react with the C6H5N. The complex is formed, that again get reacts with these cyanide groups. There will be formation of the again one complex. That complex again it should be kept for 1 day or 2 days. Then they will get the salbutamol. Mainly salbutamol we are using to treat the cough, or also it is as used as an sympathomimetic agents. Mainly we are using this to treat the asthma patients, to treat the cough mainly. Yes, my dear brothers and sisters, these are the important questions. I will upload the notes in the description. Thank you.